Good evening, guys, and today I will discuss about the pharmacokinetic principles, the absorption and bioavailability and first pass effect. In the next lecture, I will discuss about distribution, and in the previous lectures, we have covered the permeation and ionization of the drugs. So let's get started. First of all, absorption means that the entry of drug into the systemic circulation from the side of its administration. When we take a dose intravenously or it can be orally, so when it reaches the systemic circulation, it is called absorption. But one thing you should keep in mind that absorption requires two compartments. Um, the first is the site of administration, and the second is the blood into which the drug is absorbed. So I have a question that intravenously administered drugs are absorbed or not. They are not absorbed. They does not involve absorption because they are directly administered into the systemic circulation, and they do not contain two compartments. So the intravenous IV administration route does not involve absorption. So the most rapid route of absorption is inhalation, because when we inhale the drug or inhalation, it goes into the alveoli, which is rich in surrounding capillaries, and the drug is absorbed instantly. And in IV, there is no loss of drug and the bioavailability is 100%. So F is equal to 1. Okay, bioavailability sign is F. Other drugs, for example, nitroglycerin, which we take sublingually, it is the sublingual route. Other routes are extravascular administration, for example, intramuscular injection, subcutaneous, and inhalation. These methods or routes of administration have bioavailability less than 1 or less than 100% than IV. And because they have less bioavailability, because they have to pass through the systemic circulation, and the first pass effect we'll discuss in a minute. Bioavailability is the measure of the fraction of the dose that reaches the systemic circulation, and it is nothing but when we inhale or when we administered a drug orally, or when we take sublingually, when we take extra vascular routes of administration, the amount of the drug or fraction of the dose that reaches the blood or systemic circulation is called bioavailability. And as I have told you that intravenously F is equal to 1, there is no loss of the drug during the process. So a bioavailability for the IV is 100%. It's a graph representing time from administration towards the absorption and then elimination of a drug. On the x-axis we have the time, and on the y-axis we have the plasma drug concentration. Okay, the amount of drug concentration in the plasma is on the y-axis. So I have a question that this graph is for IV or it is not IV. Think logically, because at time zero we have administered the drug, and it starts to absorb gradually. So of course it is not IV, because we start with the time zero and the plasma concentration is zero. But in IV routes, the plasma concentration should have C max at time zero. Okay, and it must be extravascular route. So, let's talk about some terminologies discussed in this graph. First of all is the lag time. Okay, this is the lag time. Lag time is the time from administration to the appearance in the blood. Okay, this is the time where the blood appear when in which the drug starts to appear in the blood in the systemic circulation. It is the lag time for the drug. Onset of activity is another terminology used. It is the time from where the administered drug starts to have the pharmacological effects, from the lag time towards the minimum effective concentration. What is minimum effective concentration? It is the time when we first starts to see the pharmacological effect of a particular drug. So onset of activity is the time from administration until it reaches the minimum effective concentration. MEC means that we start noticing the pharmacological effect of a drug. Time to peak. Time to peak is simple, that the drug, when it reaches the Cmax or the plasma concentration, is at the maximum. The duration of action. Duration of action, it is the duration in which the drug has a particular action, or in other words we can say that it is also the line for MEC. The time, the plasma concentration in which the drug is above the MEC, in which the plasma concentration of the drug is above MEC, minimum effective concentration, it is called as the duration of action. When the drug is in this part of the graph, we can see its duration of action. Okay. So after that minimum effective concentration, the drug starts to eliminate and its plasma concentration starts to decrease with time. So let's revise. First of all, when we administer a drug orally, or it can be extravascular routes, so it start to appear in the blood, it is lag time. Onset of activity, when we start to see the pharmacological effects. Time to peak, when its concentration is maximum in the plasma. And duration of action, when the drug concentration is in plasma is more than minimum effective concentration. And after that, elimination occurs with time. So can we change the shape of the graph? Yes, we can. We can change the shape of the graph depending on the environment. So let's take an example. If we have stomach upset, the stomach has some any ulcer or anything that is upsetting the stomach, and we take antacids. Antacids are the drugs that neutralizes the pH of the stomach, and we use them in the for example gastritis or inflammation of the stomach. They neutralizes the pH. It means that pH starts to become alkaline. Okay, the stomach pH starts to become alkaline. Normally the pH of the stomach is 1 to 2, but it starts to become alkaline, so it starts to increase, maybe 3, maybe 4, or maybe 5. It depends on the antacids we are using. So what is the effect of weak acid and the weak base in these particular circumstances? Weak acid drugs. As we have discussed in the previous lectures, that for example, if the drug is weak acid, okay, and on the other side the drug is weak base, so they are absorbed, they are absorbed well, they are absorbed well in their pH similar to their pH. For example, weak acids are absorbed in the acidic pH, and weak bases are absorbed in the basic pH. So they are more likely to be absorbed in the pH which is similar to their acidity or alkalinity. So in this condition, when the we have increased the pH of the stomach, we have made it alkaline. So, which drug is going to be absorbed faster, weak acid or weak base? It is alkaline, so weak base is absorbed faster in this condition, and weak acids are absorbed less. And when the weak bases are absorbed faster, so what is the onset of activity? Is it increased or is it decreased? It is decreased, because it is absorbed very rapidly, weak base in this a particular example. So onset of activity is decreased and we see the pharmacological effect of the drug more rapidly. On the contrast, weak acid in alkaline pH of the stomach, they are absorbed less and the onset of activity is increased. It means that we see the minimum effective concentration or the pharmacological effect after some time. We do not see them immediately. Okay, this is some example for understanding purposes. So just remember this rule that weak acids are absorbed more in the acidic pH and the weak bases are absorbed more in the alkaline pH, and they are eliminated in the pH opposite to their own pH. Okay, so, for example, in the elimination processes, in case of renal dysfunction, there is slower elimination and duration of action is longer. When the elimination is slower, so the drug remains in the systemic circulation and the duration of action is prolonged. The bioavailability, as we have discussed its definition, that it is the fraction of the dose that appears in the systemic circulation in a particular time. It is bioavailability. We indicate it as F. So F, it has a formula, and the formula consists of two things. We compare the bioavailability of a drug that is administered extravascularly with the drug which is administered intravascularly. So what does it means? When we take intravascular dose, the plasma concentration at zero time or at very low time is maximum because it is already absorbed. We cannot use the term absorbed in the IV case because it does not involve two compartments, right? But anyways, in intravascular dose, the plasma concentration is at C max at a particular time, and this is the extravascular dose. It starts to appear gradually in the plasma. So the formula for the bioavailability is that area under the curve per os means when we take the drug orally, okay, orally or extravascularly, over the area under the curve intravascularly. This is the formula for the bioavailability, and examiners can give some scenario, pharmacological scenario, and you can use this formula for the calculation of bioavailability of any drug. Okay, for example, if the drug has bioavailability it's zero point 0.8, it means that 80% of the drug is bioavailable and 20% is destroyed, or it has diminished because it passes through the first pass effect, and it means that drug is not given IV because IV has bioavailability 1. So, what is first pass effect? First pass effect is that when we administered a drug orally, it is absorbed into the GIT and it goes into the portal vein and it is distributed into the liver. And due to the hepatic metabolism, the bioavailability of the drug is decreased, and this all process is known as the first pass effect of a drug. So, in this diagram, when we take a drug orally per os, it reaches the GIT, then it goes into the portal circulation, then it passes through the liver and appears in the systemic circulation. What would you think? Of course, the fraction of the dose decreases with time. It is the first pass effect when the drug passes through the liver, hepatic metabolism. Okay, there are some examples of the drugs that cannot be given orally. These are the drugs that are not given orally, okay? Because in this condition, when we give these particular drugs orally, their first pass effect is so drastic that in the systemic circulation, we do not obtain any dose that is beneficial to us. For example, lidocaine. Lidocaine cane is a local anesthesia, local anesthetic, and we give it intravenously. Okay. And nitroglycerin, it is also a drug for the angina pectoris, and we give it sublingually. And fentanyl, it is also given intravenously. Other drugs which can be given orally, there are no most of the antibiotics and many of the drugs are given orally. So some examples are propanolol. It can be used for the cardiac activities. And nitrates, these are given orally. Why they can be given orally? Because after they have first pass effect, a particular fraction of the dose is still remaining, that it is beneficial to us. But in this condition, the first pass effect is so drastic and dangerous that there is no benefit in given these drugs orally. So we give them intravenously or sublingually, which is directly administered into the systemic circulation. Okay, this was for today, and I hope you understand the graph, the terms absorption and first pass effect and bioavailability. And these are some basic principles for the pharmacokinetics. In the next lecture, I will discuss about the distribution. So, thank you so much. This was for today. See you in the next video.